Alrighty. So coming up, just a reminder to do the sign-in form in the chat, and one of our board members will go ahead and drop the sign-in form in the chat here in a minute. But just a reminder to do that so that your participation can be tracked, and we can let you know how many AMSA bucks you've accumulated throughout the semester. We will go through announcements. We'll have our presentation from Toya about sustainability in medicine and healthcare, like I said. And then just a reminder that next week will be a recorded interview with Dr. Howard. And looking ahead to the next couple of weeks, like I said, next week is a recorded interview. The following week, we are hoping to still have a medical school admissions committee representative here live with us to talk about the admission process, the U of M's medical school here, and to field some questions about application cycles and what to have on your application and what kinds of experiences you might want to seek out. That is a little bit on the fence this semester because of the pandemic. The interview season for the University of Minnesota Medical School did get pushed back a little bit. So a lot of the admissions committee members are busy working on the current application cycle. So if we are unable to have that representative with us live, we will be trying to conduct an interview with them and share it similarly to the physician interviews. We do have something else prepared for that week. So if that is a kind of last minute change, there will be no Zoom and we'll just be sending out a recording. But we will, we have confirmed that we definitely will have an admissions rep with us in the spring for a live meeting. So hopefully we get to have someone speak with us in a couple of weeks, but if not, that's something to look forward to for the spring as well. And then the holiday week, we are not having a meeting, just taking a break and letting everybody adjust to their new locations if you're traveling home and to the fully online format of school that will continue through the rest of the semester. And then December 2nd is another physician interview. And that will be our last weekly meeting for the semester. The following 2 weeks before finals, we will be having some stress management activities and resources sent out. And we will also be doing more MCAT prep focused and application prep focused materials as well. But we won't be having a definite Wednesday meeting after December 2nd. Viba is going to chat quickly about this week's networking series events.
Yeah, so the Physician Networking Series is a go. We've got 4 events down. So we have one tomorrow from 6 to 7 p.m. with Dr. Wendy Nguyen, who's a anesthesiologist. Then we've got one on Friday from 6 to 7 with Dr. Karen Dixon, who is a psychiatrist. We have one next Monday from 5 to 6 p.m. with Dr. Sasha Stroll, who's an ophthalmologist. And then this one's a little bit far out, but Friday, November 20th from 6 to 7, we're going to be speaking with Dr. Bazak Sharon, who's a pediatric and infectious disease specialist. So if you guys want to attend any of these events, you can RSVP with that Sign Up Genius link at the bottom. We've capped the events at 15 students, and I know some of them are filling up. So if you could RSVP as soon as possible, that would be great, especially since the first one is tomorrow, then I can send out the link as soon as possible. So yeah.
Yeah, and I did receive a couple emails this week about questions just about how to connect with physicians. I know a couple people who are in the future physicians courses are required to do a physician interview as an assignment this semester. So those are things that this networking series event would be really perfect for. You essentially just are in a conversation with one of these physicians you have an hour of their time to ask any and all questions. And these physicians know that they're attending an event where students are looking for shadowing opportunities and research and interview opportunities and stuff like that. So networking is more important in medicine than I think people anticipate. So I highly, highly recommend attending these events. Thank you, Riba. And we have either Kirsten or Rachel going to chat about retreat.
Yes, so the retreat is this Saturday from 10 to 12. We're going to have Barbara Goodwin, who is the head of the CLA pre-med department. I had her actually as an advisor my freshman year, and she is awesome. She got my entire plan for all my 4 years, made me feel very comfortable as a pre-med, and I really think that she'll be a good addition and have a lot of good advice. So she's going to be talking. We're also going to have some of our awesome board members kind of share their pre-med experiences, some of their research experiences and things they're doing outside of schoolwork. And we'll be doing breakout rooms and discussions. If you want to attend, I'll pop the link in the chat, but otherwise you can email me at the email right there. And I hope to see some of you there on Saturday. Thank you, guys.
Awesome. This is a reminder that the Kaplan scholarship applications are still open until next Wednesday. This is definitely not something that I would save for Wednesday night of next week. It is an extremely valuable scholarship. We have 5 of them this year, and they essentially cover the entire cost and all of the materials required for the Kaplan, any of the Kaplan prep courses, MCAT or otherwise. It does not need to be, you don't need to use it specifically for the MCAT, but obviously as a pre-med focused group, that is what most people who apply utilize it for. And these courses include, I believe it's a 10-piece book set. You get the entire book set, you get the flashcard set, you get an entire online portal with 8 practice exams that are all scored to give you a good idea of your MCAT score, and as well as a couple different diagnostic exams. And then you get all of the videos and prep materials or the live classes along with all of the self-guided materials, depending on which course you pick for yourself. So I would definitely really recommend checking this out if you are planning on taking the MCAT in the next year. I personally used this and I saw an 11-point increase in my MCAT score. So definitely check it out. The link there for the scholarship is included. It's a 5-question application, but we are hoping that people fill out those questions with a bit of thought, because we want these scholarships to go to people who are going to use the courses in the next year. So it closes next Wednesday, like I said, and the scholarships will be distributed by the following Wednesday. So that should give everybody at least 2.5 months if you're planning on taking your exam at the earliest in January. But if you're planning a later date, you can start your course at any time in the next year. And then because there are a couple questions about when your anticipated MCAT date is, there is some information there on the last bullet point. If you have any questions about this, feel free to email me directly. All of the applications will also be reviewed anonymously. So don't be worried about, what you're putting, just like be truthful in your replies, and they will be graded based on not graded, but the scholarships will be awarded based upon preparation for the course and need for the scholarship. So following off of that, we have a MCAT study planning boot camp next Tuesday on the 10th. It's just an hour long, and I'm going to be hosting it. We will be having a couple other U of M pre-med alumni stopping in. One speaker who works right now with the Pre-Health Student Resource Center and owns a MCAT tutoring company. Basically what the session is going to be is I'm going to be talking with those people. We're all going to be presenting about what the MCAT prep timeline looks like, where to begin. It's kind of an overwhelming process. So how to get started with that, what types of materials to seek out, both courses and kind of piecing together your own materials if you don't want to purchase a course. And then we'll essentially be guiding you in creating your schedule. So it's not only informational, but we're hoping that everybody can leave that prep session with a itinerary of the next couple of months of MCAT prep, hopefully. Andrew's going to chat quick about blood drive.
Yeah, so we're going to host our first blood drive on Tuesday, November 17th. It is at Van Cleve Park, which I included a little screenshot of the maps. It is in the parking lot, which is kind of down in the red boxy area. And the blood drive bus will be where that X is. So I don't currently have a sign-up sheet, but we are going to need 30 donors to come out and donate so that we can make sure to fill up all the different time slots. So I will be sending out a spreadsheet soon where you'll be able to sign up for the time that works for you. In the meantime, if you know that you want to donate, if you would please just email me and let me know that you are willing so I can start to get a count of how many people will be interested in donating. Awesome, thank you.
Perfect. This is a quick announcement that the suture clinic is full. If you RSVP'd for that, I know it's been open for a couple of weeks. I am sending out confirmation emails to all of the individuals who are in the group of 30 students participating. And I will be emailing the people on the wait list right now sometime this week. And if you are one of the students that receives an email, if you can follow up with information that I will be inquiring about in regards to how you would like to receive your materials for Suture Clinic, please do that as soon as possible and confirm that you will be attending or that you won't be attending, because we do have almost 30 people on the wait list, so 60 total. And if we can get some of the people on the wait list into the event so that we do have a full event, that would be ideal. Alrighty, I'm gonna hand it off to Rachel and Kirsten to introduce our speaker for today.
Hi, everyone. We're very, very, very excited about this meeting. So please welcome us in joining Toya Lopez. Toya is the Director of Operations for Health Professionals for a Healthy Climate. And she has a little presentation for us, and hopefully Daph should be able to give you access to that, Toya. But the floor is yours.
Yeah, thank you for the introduction. I can see that all of you are working pretty hard to kind of get all of your prerequisites and studying for your exam, and I'm pretty excited to be talking to the next generation of health professionals here, and so it's really a pleasure to be able to talk to you guys a little bit about climate change and how that will be something important to consider as you continue in your profession. Let me just get my screen sharing to go.
You can do it. Perfect. Okay. You're all set then.
All right, supposedly this is working, so I'm going to go ahead and start. So again, as I was introduced, I'm the Director of Operations for Health Professionals for a Healthy Climate, and we are an interprofessional health professional advocacy group that focuses on 3 different areas of focus, that being policy, changing legislation to curb the impacts of climate change, the healthcare industry, looking at how we can diminish the effects of, how we can diminish the emissions of greenhouse gases from the healthcare industry, and then also in education, which is where you guys all come in, and trying to educate other health professionals as well as future health professionals, and also change curriculum. So I wasn't sure how familiar you were all with the impacts of climate change, but I thought I'd give a fairly brief overview. So kind of starting with something that has been pretty familiar in social media is wildfires. And so wildfires are, of course, increasing because of climate change, and the smoking exposure increases respiratory and cardiovascular hospitalizations, ED visits, medications for asthma, bronchitis, and chest pain, as well as COPD. So all of these are putting a burden on not only the health system, but of course on our patients. It's also been associated with hundreds of deaths annually, and on a global health risk of the landscape to fire smoke, climate change is projected to increase risks of emissions, greenhouse gas emissions, and will further perpetuate the cycle of climate change. Along with that, there's also increased flooding, which occurs as part of climate change. As well as the immediate hazards that happen with flooding. Other hazards also appear after the storm has passed or after this flooding event has passed. This includes elevated waterborne diseases, outbreaks, mold contamination, indoor air quality problems, and the prevalence of asthma and other respiratory tract problems. This also is a big issue when it comes to food and waterborne diseases, as air and water temperatures, as well as these more intense participation patterns affect like the transmission of disease. Since we all are going to the University of Minnesota, we're pretty familiar with vector-borne illnesses, and climate is also one of the factors that influences the distribution of disease borne by vectors. Daily, seasonal, and year-to-year climate variability can result in vector and pathogen adaptation and shifts in or expansions in their geographic ranges. So another thing that is pretty hand in hand with climate change is increases of temperature, having extreme heat, and this is associated with, of course, increased hospital admissions and cardiovascular, kidney, and respiratory disorders. This also can be a risk to a lot of our patients that have pre-existing conditions, especially interactions with medications, as people who take certain medications can feel the effects of extreme heat a lot more than other folks. This also goes into the mental health and stress-related disorders related to climate change, which research has demonstrated that anxiety and PTSD is common amongst people that are affected by natural disasters, as well as floods, heat waves, and wildfires. So these are just a few of the impacts of climate change that I'm just like listing off here. And I just wanted to kind of prime you guys to be like, climate change is affecting our health right now, today. It's not something that is going to be affecting people. Well, it is something that's going to be affecting people in the future, but it is also something we're seeing at the bedside currently. And so it is something to keep in mind when you're treating your patients. So I'm going to shift a little bit over to what specifically the hospital emits in terms of greenhouse gas emissions. So you can see all these clouds are, sorry if I have to like blow my nose every now and then. I'm a little bit under the weather myself. So we can see that the hospital is a very resource-intensive industry. You can see it with the amount of PPE, personal protection equipment, that is being used because of COVID and other such waste that has already been pretty dominant in the space. So as far as like, for instance, the operating room, the OR, there's a lot of energy use for heating, cooling, lighting, and water use. When it comes to like actually transporting either people in ambulances or supplies, these vehicles also emit. as well as the actual production of these products. And then also something that can be pretty harmful to the environment is the materials that are being used for instance, different medical devices, different pharmaceuticals, and then trace radioactive products as well as waste anesthetic gases, which also contribute to greenhouse gas emissions. But as we can see in this slide, there are many opportunities to reverse this or to take action. So one of the many ways is to actually start a green team or be part of large-scale planning efforts that involve sustainability, educating your patients and your colleagues, and trying to reduce, reuse, recycle. Those are pretty quintessential, as well as perhaps carpooling and biking to work and educating your community. Let's see here. So there's so many different areas in which we can address climate change in the healthcare industry that I don't want to overwhelm all of you with listing off several examples, but I did want to connect you guys with a resource that you can use to further study this in the future, which would be looking at Practice Green Health, and you can find them at practicegreenhealth.org. And there they identify 10 sustainability program areas that seem to be pretty good in categorizing the different areas in which you can make a lot of change. For example, less waste would be looking at reprocessing medical devices. This means that instead of having a single-use device, the device is taken and then either cleaned or reprocessed, right, remanufactured, and then delivered again to the hospital, and then you can use it again for other services. Safer chemicals. Of course, there's been a long push for decreasing mercury in the healthcare space, and it is still very much a chemical that is still used, and not just in in actual surgeries and other devices, but also in the interior space, looking at is there volatile organic compounds in the carpets, like what cleaning products are you using, and are these products, do they have carcinogenic chemicals in them, and are we exposing our patients to that? There's so many opportunities when it comes to sustainable procurement, which is if you look at the bulk of greenhouse gas emissions produced by the healthcare industry, it's literally transporting objects A to B. And also with sustainable procurement, this is an opportunity for creating resilience. As you may all remember, a few years back, the hurricanes in Puerto Rico caused a very big shortage in saline and other very important medical equipment or medical pharmaceuticals throughout the country because of the hurricane that hit. And so if we are able to have more resilient supply chain systems, we'll be able to better serve our patients. So now that I've talked a little bit about and thrown a lot of things at you guys regarding all the different ways that climate change impacts health and how the healthcare system impacts the climate, what are people doing about it? That's something that is pretty important to know. So here locally, sorry if you can hear some sirens outside. I also live pretty close to dispatch. So we have Practice Green Health members, and these folks are hospitals that have committed monetarily to improving the sustainability of their hospital through membership with Practice Green Health. This includes Health Partners, Mayo, the VA Medical Center, which the VA Medical Centers across the country actually have done a lot to improve their sustainable purchasing. And so that's pretty interesting. Centric Care, Minnesota Children's Hospital, Alina, and M Health. And so you can definitely look at either their websites or talk to some of their sustainability coordinators or professionals, and they can give you also a better idea of what's going on there. And then more globally and across the country, we have, of course, Practice Green Health, and globally we have Healthcare Without Harm, which is also a leader in sustainability space in healthcare. And looking at the sustainable purchasing side, we have Green Health Exchange and the worldwide network of global green and healthy hospitals. And so these are all great resources to start to learn more about what you can do as a physician to help promote sustainability in healthcare, and also to learn more about what you can do as a physician to improve the health of your patients and how climate change is affecting their health. These are some examples of some national climate and sustainability advocacy. I would definitely check these out, especially the Medical Society Consortium on Climate and Health, subscribing to their newsletters. They often have available and free webinars that you can listen to and learn from, and it's a pretty good opportunity to be getting involved. I know at the beginning I talked a little bit about educating health professionals, but there's also a national push for more sustainability in curriculum. And so as you continue on in your education to become a physician, you may be seeing climate change more in your curriculum. And so, and definitely I would suggest to promote it to your professors and whatnot, to get them to talk more about how climate change impacts the material that you're learning. I would also, if there's a few things to take away from today, it would be to maybe as a medic or as a physician or as a future physician, to take a pledge that climate change is a health crisis, and that you pledge to improve the health of our community and our planet, and that this is part of the Hippocratic Oath to do no harm, and to like support the health of your patients and your planet. I wanted to end this with a poem called Time to Rebel. We are right now in the beginning of a climate and ecological disaster, and we need to call it what it is, an emergency. We must acknowledge that we do not have the solution under control, and that we do not have the solutions yet. Yet those solutions mean that we simply stop doing certain things. We admit that we are losing this battle. We have to acknowledge that the older generations have failed, all political movements in their present form have failed, but Homo sapiens have not yet failed. So, yes, we're failing, but there is time to turn everything around, and we can still fix this. We still have everything in our own hands. But unless we recognize the overall failures of our current systems, we most probably don't stand a chance. We're facing a disaster of unspoken suffering and an enormous amount of people, and now is not the time to be speaking politely or focusing on what we can or cannot say. Now is the time to speak clearly about solving the climate crisis, the greatest and most complex challenge that people have ever faced. The main solution, however, is not so simple, and we have to stop our emissions of greenhouse gases. Either we do that or we don't. And so we can either prevent 1.5% of warming or we don't. Either we avoid setting off the irreversible chain reaction beyond human control or we don't. We choose to go on with civilization or we don't. That's as black as white as it gets. But we all have a choice, and it's up to you and me and We need a system change rather than an individual change, but you can't have one without the other. So today, we have that opportunity to do that change, and now is the time to rebel. So thank you for listening to my presentation, and I would like to open it up to questions, as I find that that is often the best way to be able to talk more about like the things that that you guys are interested in learning more about.
We are also going to go ahead and stop recording at this time. So if you are uncomfortable being in the recording, you won't have to worry about that at all.